Hi, I'm Chris Urquhart with Natural Awakenings Magazine, and I'm here with Dr. Deborah DeMarta of the Institute of Health and Wellness. Dr. DeMarta is an MD, board certified in general, aesthetic, and colorectal surgery. She's also board certified in anti-aging, functional, and regenerative medicine. So our goal today is to bring you some positive health news, some things you can be doing today to stay healthy. Thank you, Dr. DeMarta, for talking with us today. We're excited you're here.
Thank you, Chris. Honored to be here, truly.
And let's go ahead and talk about what are you doing in your office right now to keep people healthy?
Absolutely. It's not different than standard operating procedure, really. As a surgical office, disinfection, high-level disinfection is pretty much our procedure. But assuredly, every single surface, including doorknobs and toilet handles, countertops, every single surface is decontaminated between each patient, but that's not new to a surgical office. That's a standard process. Additionally, we've limited flow through the office so that there is never more than 3 patients in the office at one time. They are located in separate rooms with closed doors. The safety extends itself even more than that because we have a wonderful air system. It's called a hydroxyl ion generator, which makes our environment, because it is a surgical as well as a medical office, exquisitely clean from an air standpoint, from a surface standpoint. It's germicidal, fungicidal, and virucidal, so that's a really good thing. So we don't usually have wound infections or anything like that because of the quality of the air is superb. Similar to that found in operating rooms, dialysis centers, meat packing houses, breweries, the like. So very commercial air system. The other thing is we're really at this point now, it may change in the future as we need to help out with what's going on in the world. Currently, we're not taking any actively sick patients. Our county and our governor is recommending that we have those patients screened by appointment at official testing sites. And I think that's a good idea right now. In addition, we are doing quite a lot of telemedicine. And my heartbeat for everybody really is, isn't it better to work on the front end at prevention and boosting immune system than, trying to mop up the mess at the end? So
Right.
that's pretty much our.
So it sounds to me like you're not just doing the CDC guidelines in your office, you're above and beyond because of your surgical environment. You're not only trained in those procedures, so you have plenty of experience at it, but you also have an environment that's, goes above and beyond what we're going to find in a normal, even health practitioner office.
Yes, absolutely.
Yeah, that's fantastic. So you talked about some of the immune boosting services that you're providing. I understand you have some vitamin C infusions, and there's a lot of talk right now about vitamin C and its connection with the virus. Can you maybe share a little bit of that?
Absolutely. So historically, vitamin C is not new to any practice that is expert in IV nutritional medicine. Vitamin C goes back years and years. It is bactericidal, fungicidal, virucidal. It's used for Lyme. It's used for Epstein-Barr. And the evidence, okay, coronavirus is, the genus corona is not a new virus. The subspecies of 19 is, but it's been used in China. And currently there are ongoing clinical trials for mild, moderate, and severe disease, as well as a preventive treatment arm by Dr. Zhang, who's an MD, PhD there. And the beauty of, looking at some of the Asian countries and speaking to their infectious disease specialists is that they've been through this with SARS, with MERS, with, those are coronaviruses of different serotype, swine flu, H1N1, and there's a lot to be learned from that. So with not only social distancing, but also the usage of masks for especially high-risk patients, which I would just like to comment on that we're considering anybody 65 and over, not that that's really advanced age, but we're considering that as a risk factor for possible more serious side effects, as well as any previous chronic condition, whether it's chronic pulmonary problems like COPD, um, patients that are cancer patients undergoing chemotherapy, patients with heart disease with impaired function, patients on any immunosuppressive therapy, or going through any infections like Epstein-Barr with positive IgM levels that cause immunosuppression. So that classification, I think we need to handle a little differently and more aggressively. I understand that and fully support what our president and our leaders are doing. I do know that they're working very hard to obtain more PPE equipment and N95 masks. And I do think that high-risk patients, if they don't have the ability to wear a mask, somebody else needs to shop for them. I don't think they need to be in areas with more than 10 people or out at all, because it's the mortality rate is so much higher and can really reach about 30%. The virus itself, it, all viruses are spread pretty much in the same way. They require to be sneezed out or coughed out, and the size of particles is generally about 5 microns. So that enables a trajectory to come out of the patient's nose or mouth and land about 6 feet away from them. That's why we're having the issue with surfaces, as the specialists are really learning more about the DNA and the how this virus is spreading. So it's very rare, although it is possible for viral particles to be aerosolized. That means it's much smaller than 5 microns. But in general, because the virus has to attach to a mucous membrane in the nose or in the throat, we're routinely recommending all of our friends, family, and patients to use silver spray for the throat, as well as intranasal silver prior to leaving the house, if they have to leave the house, and upon returning. Additionally, we're recommending the use of, if it's obtainable, silver gel or an emollient hand cream that has silver in it for their hands as well. And then high-risk patients, maybe gloves while they're out and about, which they really shouldn't be out and about, as some prophylaxis. Silver is not dangerous. There's a lot of false information out there about, the use of silver is dangerous. It can turn you blue. It was the very first antibiotic we've ever used, that and sulfur and copper. In surgery, it's used in almost every surgical wound, in terms of a dressing for a moist environment to improve wound healing. And the properties of it being antiviral, antibacterial, and antifungal are, there's ample evidence there, even governmental white papers in terms of the ability and efficacy of silver.
So if I was looking for silver, am I looking for colloidal silver? And the difference is you mentioned a few different ways to apply it. So you said you could have a nasal spray or cream, just to get clear on what.
Right. The various companies differ on particle size. So the colloidal is a little bit bigger of a molecule. Although there is evidence that you could turn blue by drinking silver, normally that would be very large particles silver. And somebody making, silver in their garage in the back room, we've seen it. So quite honestly, the smaller the particle, the safer the silver is. So some people even call it homeopathic silver. Hydrosol silver is really more the type of silver, just a much more smaller particle. And then it's more bioactive because it can get into the cell, because the way viruses work is they have to penetrate the cell. So in order to replicate. So that leads me to the second thing. How can we support that cell? Simply, every cell in our body has a lipid bilayer of fat in its cell membrane. And most patients that we examine, you can do an exam where you examine the skin on the outside of the upper arm, and if there are little bumps there, that is a physical sign of fatty acid deficiency. So from a dietary standpoint, good fats, MCT oil, coconut, good sources of olive oil that are clean, organic, please, because there's lots of dirty oil on the market. Essential fatty acids that are high in omega-3s that are anti-inflammatory. And please, supplements should be, I think we got paused.
Okay, I think we're back.
Oops, we had a pause. And fatty acids that are high in omega-3 fatty acids. Foods in that category would be cold water fish like salmon, which is easily obtained right now, and good quality fish oil. Please, no over-the-counter non-CGMP supplements. Supplements can be very dirty, and there are hundreds of cases of patients in our practice, as well as in the United States, with poisoning from mercury dioxins, PCBs from fish oil that are not from clean sources. So omega-3s are a really good source of those good oils for the membrane of the cell. So next thing, since we're in the fat category, in terms of nutrients, fat-soluble vitamins, vitamin D is more than just a vitamin. It is a hormone, and it is an immune-enhancing hormone. Generally, in normal circumstances, we test everybody, and everybody's internal medicine doctor or family practice doctor should be checking vitamin D levels. It should be standard of care. And generally, we want to push those levels a little higher right now. And generally, we want them between 60 and 90, not higher than 100. There is no toxicity for anybody who's in that range reported whatsoever. So we're actually recommending, if somebody has not had a vitamin D level and doesn't really want to get one right now, probably safe to take 5,000 IUs of vitamin D3. It has to be D3. And in many patients that we know their level, whether it's intracellular or by serum, we're actually pushing them up to 10,000 IUs, and some of them with vitamin K as well. So that's vitamin D. The other fat-soluble vitamin is vitamin A. Vitamin A, food-wise, is going to be in anything that is so beautifully orange. So your carrots, your sweet potatoes, your pumpkin, and vitamin A is amazing to help the neutrophils, the white cells, be really working at their best. So from a milligram perspective, I would say average risk patients with no comorbidities, at least 25,000 milligrams to be a good dose, and maybe high risk, maybe up to 50,000.
Are these doses per day, per week?
Yes, thank you for that clarification, per day. The fat-soluble vitamins, both D and vitamin A, both need to be taken with a meal that contains fat. So in order to have adequate absorption into the cell. And then some of the water-soluble vitamins that I think are so important. We touched on vitamin C for a bit. Vitamin C, it's not expensive. It is amazing. For low-risk patients, healthy, young, I would say 3 grams a day, that's 3,000 milligrams. There is a caution. As a surgeon, I have opened many a belly in well-meaning people who want to take a lot of vitamin C without food. It is not a good idea. vitamin C is ascorbic acid. It's an acid. I've had to fix gastric perforations that were freely perforated. So please, vitamin C, I would say 1,000 milligrams with each meal, or a little bit safer. And for higher risk patients or people on the front line, nurses, doctors, healthcare workers, I would say a liposomal version of vitamin C. Liposomal means that you take a good fat and you wrap it around the nutrient that you're trying to get into the cell. And that radically improves bioavailability, excuse me, and tissue levels. And it actually is pretty much like giving IV vitamin C because of the tissue levels that are achieved. And again, GMP certified, and patients can, and the public can find this on the bottle, or they can call the 800 number or look on the website of the supplement. Health food stores should be able to help educate with this as well, to be able to find out how do you find out if your supplement is a safe supplement. And basically that designation is called General Safe Manufacturing Processing. And the government, the FDA and FTC are involved in that process. And every single batch that is made is tested with spectrophotometry to see exactly the peaks of what is in that capsule. And assuredly, they're the correct amounts at end expiration time, and no toxic substances that came in from sourcing. So that's real important. So vitamin C. So high risk, I would say liposomal, and I would say a tablespoon, which is generally about 3 grams. You have to read the back of your label depending on the brand, but 3 grams at least twice a day, that would be 6 grams. And the study in China by Dr. Zhang is actually looking at a 6-gram dose for prevention of COVID. So that would be a good place and a safe place to start. Little caveat about vitamin C, you can see a little increase or a large increase in stool frequency with vitamin C. So maybe if that is a factor, you can cut back a little bit and then gradually go up on your vitamin C. And that should improve bowel tolerance. And truly, you can go up as high as, a full treatment dose. Treatment doses IV can actually go up to 12 grams to 25 grams of vitamin C in a large bag of crystalline normal saline dripped over about an hour. Now, IV vitamin C, all of us that practice functional medicine, we're feeling the strain of shortages across the board of vitamin C, whether it's taking internally and enterally, orally, or whether it's given IV, and we're all being placed on, you can only have 6 bottles of this and 5 bottles of this. So, but we're working so diligently. It's actually become a new full-time job for me in terms of trying to make sure that we have enough of everything. I think we need to order above and beyond what we need just to stay safe and possibly for treatment use as well. So other caveats about vitamin C. Patients, there is an enzyme called glucose 6-phosphate dehydrogenase. And that enzyme, if a patient has a deficiency of that enzyme, it's really not safe to be treated with high dose vitamin C. The practitioner has to be really safe, and also, if they have abnormal renal function. So in our practice, and I would recommend that to anybody else that is doing functional medicine, to really do a quick blood test. It'll come back quickly. You can check a G6PD easily. Check their vitamin D while you're at it with that, and just to make sure it's safe, and their renal function, to make sure we're doing no harm.
So these criteria that you're concerned about are for when you're doing the IV vitamin C, or would it also be an issue if you're trying to do a high dose oral vitamin C?
Possibly, if you're going under safe, probably do about 6 grams to get up to 12 grams. I think there is a possibility of getting in trouble, definitely with IV. It can cause hemolysis, and that is a big problem because if you're breaking red blood cells, that can cause renal failure, all kinds of problems. So definitely a quick blood test before getting IV vitamin C. So that's my only concern with some of the drip lounges that we see, popping up like tulips in our community that, are we testing this? So, we need to do safe medicine. So that's vitamin C.
So I understand, though, for some people may not want to go get blood work right now, but I understand you also can offer blood work in your office, which may be, a better option than walking into a lab.
Yeah, I really don't want my patients or anybody's patients right now sitting in a lab with other people's undue risk of exposure. And yes, we definitely provide lab services. We try to hook the patient up to which insurance is going to best cover that service as well. And both the G6-PDH enzyme as well as the D3 is easily covered by insurance. So that's reassuring.
Awesome. So you also have, did we cover any homeopathic and herbal remedies? I understand that if people come in for an IV vitamin C protocol, you also have a host of a little package that you want them to go home with that are some other items. And I think you covered some of them, but I'm not sure we hit them all.
Exactly. So keeping with categories, the water soluble category, I think everybody needs a B complex all the time, every day. Right now, even more for the added stress, the financial stress, the emotional stress that's going on. A B complex to help not only with the stress, but the B's are so important. B1, B2, and B3, thiamine, riboflavin, and niacinamide. They are workhorses. They make ATP energy. What cell doesn't need ATP energy to be healthy and to be preventive of disease? And in addition, those three vitamins are essential to achieving detoxification on a daily basis. And we live in a very, very dirty and toxic world. So B complex is important. We also generally add methylation support. Methylation support is methylfolic acid and methyl B12. We do chip levels as well, but most people really do need that. And it's based on genetics of a pathway. It's a folic acid pathway called MTHFR. I've heard some funny acronyms, some bad words on that one. But anyway, that's a really good supplement. We have one that has 6 complaints because it's overwhelming to take so many supplements, and that has been my trademark. So a supplement with as many things in it, reaching the optimal goals would probably be the best approach to that. So those are the water solubles, and then minerals. So everybody knows about zinc. We lost again. Here we go. Zinc is an amazing mineral that is.
We need to pause.
There we go. Zinc is an amazing mineral that is often found deficient on testing of many individuals, and radically important for the immune system, radically important if somebody gets sick from healing because you can't cross-link collagen without zinc. It's just not going to happen. So zinc at least 25 to 30 milligrams with a meal. I would caution the early intake of zinc because it can really nauseating on the stomach, even taking food in the morning. So maybe not a healthy patient once a day, a patient with more comorbidities, I would say maybe let's try to hit that zinc twice a day. The only caution is zinc for prolonged periods can deplete copper levels. So around a copper element of copper, not more than 2 milligrams per day would be a good idea as well. Selenium is also a good immune-enhancing mineral. Most of your multivitamins should have enough selenium in them. If you're not on a multivitamin, maybe add some selenium as well. In terms of your question. Sorry to interrupt you.
I was going to say, let's pause for a second. I think we're having a little bit of trouble with the.
Okay.
Okay, let's try again. Are we?
Okay. So the other category of supplements would be considered immune enhancing. So that can range from products that contain medicinal mushrooms, reishi, maitake, and other herbal substances like amino acids like L-lysine, which is antiviral, the glycolas, which comes from honey. So those are some, and they're most good quality CGMP labs, without mentioning names, have immune enhancing formulas. And I think adding that during this time would be some good wisdom. Most of them are taken one time during the day, 2 to 4 capsules, depending on what the product is, what the correct dosage is. Would be beneficial. So essential oils are very powerful, extremely powerful. They can be used topically on the sole of the foot. Something like frankincense, which is just really it's very historical background. It can be, there are blends of essential oils, and I will mention a couple of companies. It's no preference here. Young Living has a blend called Thieves, which they make a hand soap, they make an essential oil. doTERRA makes one called On Guard that even is always as a counter spray in the break room, as well as how we steam clean our floors. So not only can they be put into an aromatizing diffuser for good quality air, they can also be used topically as well. The other category are homeopathic things. My favorite is probably oxalinicum. It's widely available, and its properties for antiviral are incredible. Generally, it comes in a 3 little container full of little babies. You have to be careful; they won't go down to breathing height. Excuse me.
He just wants to be part of the
No. So that's a little issues or rescue. So oxalinicum is generally taken 3 doses in the same day. In terms of homeopathic benefits for the first sign of sore throat or flu-like symptoms, very, very effective, and it can be repeated. It's generally 3 doses each day.
Fabulous. Well, thank you so much for all of that information. There was a lot of really great information in there for us. We're going to have to take note, watch it again and take notes, because you gave a lot of solid tips for what we can do, just to try and stay healthy and boost our immune system and get through this unusual time.
Absolutely. And I just want to end with a little bit of a spiritual note. This is not a time to get fearful and worried, and it's easy to do. If you watch the news for that whole hour, which you need to stay updated, it's enough to cause fear and anxiety. But fear and anxiety do not promote wellness. They promote dis-ease. And we need our immune system. We need to be able to be making antibodies and have NK cells, killer cells, be working, and T killer cells doing the best job they can. So a daily practice of stress reduction. One of my favorite practices is, and everybody that's on lockdown now, use your YouTube. A favorite thing that you can look up is Qigong. It's Qigong. It's medicine. It's 2,000 years old. It's from China. It is a medical practice of slow movements that have coordinated breaths but it's also mindfulness and connecting between earth and heaven. And, during this time, we don't want to be in fight or flight, high cortisol, high epinephrine state. We want to stay balanced, and we want to really plug in. Other moves to get grounded would be prayer and meditation. There are many guided imagery sources available on YouTube that are free of charge. One of my favorites is Health Journeys. We worked with them, a lady named Deborah when I was at the Cleveland Clinic. We did a study using guided meditation preoperatively, intraoperatively, and postoperatively. And my God, decreased pain, decreased stress, improved outcomes, shorter hospital stay. So the mind connection to all this can't be understated, not to mention that stress causes the cells in the gut, which are supposed to be tightly adherent with tight junctions, that is regulated by a protein called sonulin, and keep that gut non-permeable so that whatever you eat stays in the lumen of the bowel and goes through digestion and elimination. But if there's a breach and you have what lay people call a leaky gut, we eugenicists call that a permeable gut. That's not good because there is a triad called the gut immune brain triad. And when the gut is leaky, and there are 3 systems in the body that have a very thin membrane. The gut is just one cell layer thick between the outside world and the inside world. The same thing is true of the brain, blood-brain barrier, and the cardiovascular system. So when you are eating inflammatory foods, gluten, dairy, I'm sure I'll get flack over the dairy, but I will stand firm on that one. Inflammatory foods or sugar are going to cause a more leaky gut, and so will stress. And that's going to drop your immune system like a tank. So on the last note, of course, as a colorectal surgeon, we always want somebody to bend over, smile pretty. I'm going there. I will end on just a short synopsis of what can we do for gut health. Fiber. And 25 to 30 grams a day. And we don't eat that much. You can't eat that much. Even if you're vegan, even if you're a vegetarian, I promise you're not getting 25 to 30 grams a day because you would need to talk every day. And that would be hard unless you're, blending and eating still. So a good source of natural fiber that contains psyllium or methylcellulose. That is essential because the bacteria, the good bacteria that confer immunity to us, are called beneficial bacteria. They eat that good fiber. They also eat complex carbohydrates, and in turn, they poop out short-chain fatty acids, which actually are the essential nutrients that the cells that line need to have. So fiber every day. Generally, when you take fiber, you have to gradually increase to 1 level of scoop per day. You have to drink it quickly. It can get thick. You can put it in your smoothies. And you should increase your intake of clean, pure water because it will require more water to have good elimination of bad fiber. And then other good health tips, a good broad spectrum, high count of CFU bacteria kept in the refrigerator. My favorites are commercially available BSL-3 or Bispayam if you're not dairy intolerant, to build up that reserve of beneficial bacteria. And then the fatty acids we already commented on are essential for gut health as well.
So are you referring to probiotics when you're talking about
probiotics? Yes. And a cup of yogurt is not a way to this thing will go away. Is not a way to get your probiotics. There's really no living bacteria in yogurt, even though it says so. So a probiotic to be taken every day, especially now. Really, really important to immune health, because at least 70 to 80% of our immunity is because of gut health and because of those beneficial bacteria. So that's truly, truly important.
Right. And I heard you mention the refrigerated as a point, and it's my understanding you want to choose a refrigerated probiotic because you know it was refrigerated when it was transported. Is that accurate?
Correct. And supplements that are CGMP certified, what it says on the label. So say it says 100 billion organisms, and CFU is colony forming count. That's what's promised at the time of end expiration. So when you get them, they have far more than that. And at the end expiration, that's what's promised.
That's good. I did not know that. Awesome. Well, thank you so much.
My pleasure. Truly, truly.
Yeah, very much enjoyed it. So if you're watching and you want to consult with Dr. DeMarta, she is located at 218 Southwest Atlanta Avenue in beautiful Stuart, Florida. And she can be reached at 772-539-9556, as well as the institutehealthwellness.com. Again, thank you so much for all of this great
information.
And everyone,
stay safe.
Thank you. You too. And everyone,
stay home, everybody.
Yes, stay home, be well, but stay connected. Thank you so much.
God bless. Bye-bye.